Thank you for listening to this webinar, which provides an overview of the Road to Resilience requests for applications put out by the Office of Child Abuse Prevention. This webinar is only meant to provide a basic overview of the Office of Child Abuse Prevention's vision, mission, and values, and how they align with the purpose of this RFA. This webinar will likely answer general questions that potential applicants may have about applicant eligibility and criteria and the purpose and requirements of the RFA. More specific questions will be responded to on our website on December 1st via a question and answer document. The OCAP is a bureau within the California Department of Social Services. The CDSS is the administrative structure that monitors the California child welfare system and is focused on ensuring child safety, permanence, and well-being for children engaged or served by the child welfare system. The OCAP ensures that successful prevention strategies support and are integrated as part of the CDSS initiatives and activities. The prevention of child abuse and neglect is most effective when families can ensure their child's safety and well-being and thus do not engage or require child welfare involvement. The OCAP believes that when families are resilient, parents are more likely to withstand times of stress in ways that do not compromise a child's safety or well-being. Therefore, the OCAP seeks to build resilient families and communities as an essential prevention strategy. The OCAP is responsible for both statewide prevention endeavors and monitoring local prevention activities as part of federal requirements. The purpose of the 2015-2020 Strategic Plan is to articulate the OCAP's vision and plan for preventing child abuse and neglect in California. The plan describes the core values that guide all the work that the OCAP does and the specific goals, objectives, and activities that will be implemented to achieve overarching goals. A wide variety of sources were consulted during the strategic planning process, and both quantitative and qualitative methods were used to analyze the findings. The OCAP's activities and funding strategies will be informed by the following 6 guiding priorities. Promoting strengths-based approaches. The OCAP promotes the widespread incorporation of family strengthening approaches such as integrating protective factors as an essential prevention strategy. Engaging and empowering parents. The OCAP will advance approaches to meaningfully empower parents as they support and advocate for their families and inform prevention service and policy systems. Focus on high-need populations. Priority funding will focus on prevention strategies to address the needs of children and families impacted by overrepresentation in child welfare systems, child neglect, at-risk infants and children, vulnerable families, and poverty, and/or economic challenges that impact families. Cultural responsivity and relevance. The OCAP will seek to ensure culturally responsive and relevant resources, best practice models, and implementation tools to share with counties and community-based prevention partners. Effective data-driven approaches. It is expected that all prevention approaches advocated by the OCAP have the best available evidence and, at a minimum, are data-informed, implemented with fidelity, and employ high-quality assessment strategies to monitor outcomes. Building prevention partnerships. A goal of the OCAP is to build local prevention partnerships through capacity building, models, and community resources. Request for applications, Road to Resilience. A total of approximately $400,000 to $600,000 per grantee per year of federal funding will be available for the Road to Resilience program with the grant period beginning on July 1st, 2019 and ending June 30th, 2020. The OCAP reserves the right to determine the number of grant awards and the final amount of each award. The OCAP will identify up to 15 awardees. The funding amount is provisional and contingent upon OCAP receipt of federal grant awards. The Road to Resilience program is supported by Federal Child Abuse Prevention and Treatment Act funds. The applicant must provide evidence that demonstrates the ability to meet each of the following criteria. The forms of evidence may include related credentials, certificates, and documented experience in serving the target population. The OCAP does not specify what type of agency, organization, or provider should apply or act as a lead agency. However, they should be able to meet the detailed criteria. This includes 1. The ability to successfully partner with health service providers, such as federally qualified health centers, community-based organizations, and county government agencies such as child welfare, behavioral health, and public health. A memorandum of understanding, or an MOU, will need to exist between all members of the partnership. One of the partners of the MOU will be either county child welfare or tribal child welfare. The OCAP will accept statements of intent from partner agencies at the time of the application submission, but a signed MOU will be required prior to the execution of any grant agreement. 2. The ability to identify and reach the target population in areas with high substance use. For example, areas with high emergency room visits associated with substance use. 3. The capacity to employ a navigator or navigators in a timely manner to provide in-home case management services and link the target population and their families to concrete supports and parenting supports. The navigators must be based at the location of the partnership's health service provider. 4. Applicants must demonstrate the ability to hire, supervise, and/or train navigators to complete the following: in-home case management that links the target population and their families to appropriate services and resources for concrete supports and parenting supports. The ability to obtain and incorporate feedback from the target population to determine appropriate maternal, child, and family supports. Provide services utilizing a trauma-informed approach. For purposes of this grant, trauma-informed is defined as interventions, practices, services, and supports that recognize and respond to the varying impact of traumatic stress on children and their families. To address substance use, including its risk factors and interventions, prenatal and postpartum maternal and infant care. 5. The lead agency of the partnership must be willing and able to actively participate in shared learning conversations, training, and technical assistance, and evaluation opportunities provided by the OCAP. Preference will be given to applicants that are affiliated with Native American tribes in California, including federally recognized tribes and nonprofit tribal organizations, and to applicants that are affiliated with populations disproportionately represented in the child welfare system, as well as geographic areas lacking in resources for this population. The OCAP is committed to preventing child abuse and neglect and its lasting effects by strengthening families and the communities that surround them. The OCAP seeks opportunities to better leverage partnerships as well as promote and integrate statewide and local agendas for child maltreatment prevention. As a result, the purpose of the Road to Resilience RFA is to foster collaborative efforts among health service providers, community-based organizations, and related county or tribal agencies to reduce substance exposure to infants. To strengthen supports for pregnant women with known histories of substance use, pregnant women with current substance use, and mothers of substance-exposed infants. For the purposes of this RFA, we define substance-exposed infants as an infant aged 0 to 12 months whose health or safety is affected by the mother's prenatal or perinatal use of alcohol or other drugs. And to provide in-home case management services to link the target population and families to community-based services, including parenting supports and concrete supports that will prevent substance use or relapse and assist the mother to provide care to her substance-exposed infant. Please note that throughout the RFA, the OCAP does not specify specific treatment models or interventions other than to describe trauma-informed approaches. This is to allow the applying party the flexibility to utilize models and interventions that best meet their community's unique needs. Thank you for listening to this webinar. Questions from applying parties have been gathered and responses will be posted on the OCAP website on December 1st, 2018. Questions were accepted until November 20th, and as such, no additional questions will be accepted and provided with answers on our website. Thank you.